Coming up today, the important but often overlooked step in the cancer journey, regaining your self-esteem, your body image, and embracing the new version of you. And later in this half hour, Halloween safety. Our poison control pals show us how to make sure that makeup and face paint is safe for the kids. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Cancer treatment can change how you look and how you feel. Numerous studies have shown body acceptance after cancer is key to overall quality of life. But what does it mean to accept, or rather fully embrace, who you now are? Two of our breast cancer patients are here with us to share their personal experiences from their cancer diagnosis to thriving in their new skin. We also welcome Heather and Cammie Crank as well, and our plastic surgeon with us, Dr. Richard Corentager with us, and you help bring these women back to their old selves again, right?
Yeah, we've got a team that really works well together, and I think we're able to do some really nice things.
Yeah. All right, Dr. K, we're going to catch up with you here in just a moment, but I want to start with Heather, because you and your husband were just recently on our program. You had a mural painted near the Cancer Center, a little moral support, if you will, a lot of moral support, if you will, for women with breast cancer. And kind of in your own words, explain the importance of breasts to a woman. We talk about breast cancer, breast health, but just what is the real meaning from your perspective, just the meaning of what breasts mean to women?
Well, it's kind of that part of the essence of who we are. It's part of our femininity. It's how I fed my children. So, I mean, for me personally, my breasts meant a lot.
Kind of like you don't know what you got till it's gone, right? We don't really think about it.
Yeah, well said. Very
well
much
said. So, in fact, it was your original breast augmentation. You know, you wanted your breasts to look their best. You had two kids. You said you fed your children, so you have an augmentation. But it was actually something that happened with your augmentation that led to the discovery of cancer. What happened?
Yeah, so I woke up one morning and realized that one side of my breast implant had completely deflated. And so my plan was to get into plastic surgery as quick as possible, get those girls put back together again. And fortunately for me, the plastic surgeon that I met with insisted that I have a mammogram, which was a lot for me because I was only 37, and so I wasn't at the age of 40 where I needed a mammogram. So for me and a busy mom, I was like, I don't have time for mammogram. I needed this boob put back together right away.
Makes sense.
And so luckily, I followed through with it and had the mammogram because that's what found my cancer, and not even on the deflated side. My cancer was on the side that didn't deflate. So it had nothing to do with the implant that I got cancer, but that's how I found that I had cancer.
Wow. What a strike of luck, if you will, for that. So now you're in the middle of procedures, multiple of them. Why was the reconstruction process so important to you? And is that something that you talked about off the bat with your doctor when you were diagnosed?
Definitely. My team here right away, kind of talked about what we needed to do to rid cancer. That's number one priority. But then talked about steps that we would take to help put me back together again, if you will. And so that was really important to me from the beginning, and I had a great team here to help guide me through that process.
So, Cammie, what was it like to wake up from a surgery that helped extend your life, but now your breasts are gone? What did it feel like? Was that something that was even on your radar, or was it something you were really in tune with?
Well, often when I got my my surgery, my double mastectomy at the Indian Creek campus, which is also where my cancer was diagnosed, stage 3B in 2015. So often when I drive by that hospital, I'm like, I think that's where I lost my breast. But before the thought leaves my mind, I'm like, that's where my life was spared.
Yeah,
so
that is a really good way of looking at it. So what went into your decision to have reconstruction?
You know, I never thought I wouldn't, I guess. I think that's the way the KU doctors present it. And fortunately, I have great insurance also that covered it. I was at Gilda Club and actually met Dr. Corentager and his lovely wife, and the plastic surgeons were there. This was 2015, just a couple months after I was diagnosed, and describing the different ways you could have reconstruction. And that's when I first heard about deep flap, and I thought, wow, I hope I can have that. And then my breast surgeon, Dr. Amy Jew, is the one who recommended Dr. James Butterworth in plastic surgery here, and then he described all about DEEP and said, yes, you're a great candidate. And so
and the options have evolved over time. We'll talk more about that, Dr. Korntager, but the number one goal is to rid these women of cancer and to get them through their treatment. When do patients first hear about the reconstruction process? Pretty soon after the diagnosis, correct?
Yeah, it's very quick. It's very quick. And you know, I think the critical thing is that we really look upon this as a team, and it's a team approach. So we have a multidisciplinary group that looks after all of our patients, and we're part of that team. So they will hear about us. There are at times, depending on how the scheduling goes, where I may see a patient before the breast surgical oncologist. And so we have to be sort of really thoughtful, and we have to be very well coordinated with the messages that we give.
Well, let's talk about the messages. What are those conversations like for you personally as a physician? How do those conversations go? And you know, kind of in that place where a woman is, and so much going on, so much on their plate, and you're here to help. What's it like?
Well, you know, I view it first as listening. And, you know, it's a matter of giving people time. Everybody's at a different place in the journey in terms of how they're processing the information. So we have to try to be cognizant of where they are, what information they need. You don't want to overload people with information. And we always, at the end of every consultation, any discussion, it's always, you know, do you have any other questions? And then we finish off with, if you do have questions that you think of when you leave, because that's frequently what happens, then we'll make arrangements to get together again. We've got fantastic nurses in plastic surgery who people will be, you know, texting or using my chart to stay in contact, and, you know, questions get passed along that way as well.
Is reconstruction considered part of the cancer treatment? I guess, meaning
Yes.
is it covered by insurance?
It is. It's mandated. So if your insurance covers the treatment of breast cancer, then the reconstruction is covered as well.
So Cammie had mentioned DEEP flap. So tell us a little bit about what DEEP flap reconstruction is and how it differs from maybe other type of procedures that have been available in the past.
So the DEEP flap is a very specialized form of reconstruction that uses what we call autologous tissue. So it uses your own tissues. And the DEEP flap involves taking tissue from an area where many people don't want it, don't want to have the excess, which is their tummies. And it involves very carefully dissecting out the blood vessels that supply that tissue, and then hooking the blood vessels back up underneath the sternum or the breastbone.
So Cammie, you've been brave enough to share some photos, some before and after photos to see what your chest looked like after these procedures. Just to kind of talk us through what we're seeing, and Dr. K, jump in too, so we understand where that skin is coming from.
Well, Dr. Butterworth told me you'll hate me at the beginning, but you'll love me at the end. It was an 8-hour surgery back then. I don't know if it's been improved and faster now, but then the stomach, it hurt so bad, you know, where they take that. It's so tight and
yeah,
but that's the end result right there. If we can keep that on a loop, I'd like to keep looking at that. But
the end result is pretty remarkable, because really what you're doing is you're replacing like with like, and that sort of patch of slightly lighter skin in the center of each breast, that is from the tummy. That is the tummy skin.
And that's the end result?
And there's an end result. Where
that looks darn good.
Yeah, you can see it is so natural.
Very. Heather, what was your experience like having this particular procedure, and were you, I guess, excited to hear about this way of taking skin from your stomach and just moving it a little north?
Well, yes, you'll hear me say often, if I had to have cancer, at least you also gave me a tummy tuck. So, I mean, I have to look at it in a fun way. But yes, surgery was intense. Mine ended up being 10 hours because they had I had a big hernia they didn't know about, and they had to fix why they were in there. And I'm into my third, I've just finished my third surgery, and I have one more to complete the process.
Go ahead.
Sorry, let me interrupt for just a second, because one of the things I think is really important to understand is that Every woman's goals are different. One of the things that you talked about is trying to make sure that women are comfortable with their final result. In some women, that may mean minimal in terms of revisions. In other women, it may mean more. So it's really a partnership, and I think that's an important aspect to sort of highlight.
So I guess in a way, like somebody might be one and done, and somebody else might need to come back for some fine tuning because they're not completely happy, and your goal is to get
Correct.
them to where they want to be, whatever that looks like.
As long as we feel that we can do it safely, then absolutely.
You just want them, you want them back. So
Yes.
overall, Cammie, Heather, happy with your overall image and your appearance?
So I had the deep flap, and then because my cancer was only on the right side, that's where it was radiated, and so that skin was less pliable, tight.
The skin has changed.
And so that breast ended up smaller, and so I did 3 liposuction fat grafting, is that the way to say it?
Yep.
Surgeries, each 6 months apart. So this is a long process, and then the very last is the nipple and areola tattooing, which I guess some women go without even doing that. But
you did that.
I did that, and so Dr. Butterworth is like, that's the very last thing, so we want to make sure that you're satisfied before we move on. And it was all about what I wanted. Like you said, it wasn't like, like this is what I think you should do. So.
Heather, I mean, we're talking about embracing the new you. Have you gotten there yet? I know you have one surgery to go, but
Yeah.
are you starting to see this light at the end of the tunnel?
Oh my gosh, yes. I mean, bringing me to tears. I'm so happy with the transformation that my body has made from where I started after my body being poisoned with cancer and chemo, and I feel like myself again. I actually feel like a better version of myself now. I just feel full of so much hope, and I have a whole new outlook on life, and the team here has really helped bring me to that point.
So we also know it's not just about breasts. The skin changes, the weight, your weight changes, and in fact, you wrote a book about losing your hair, because you said your hair was your identity. It was like your crown, and you wore it so proudly, and then all of a sudden it's gone.
Right.
What does hair mean to a woman?
To me, that was harder than losing my breasts, really, I guess, because the hair is out there and everyone sees it. And that was my best feature. I'd always had long hair, and
That fell out, as we can see here.
Yes, so I've actually lost it 3 times now in my cancer journey. So, yeah.
So some of these are photos of you as you were kind of going through your different phases, and I want to also show some tattoos that you had, because we talked about the nipple and areola tattoos, but they also tattoo your eyebrows as well, right?
Yes, because I lost my eyebrows too.
That's hair. So tell us how exciting that was for you. You don't, again, talk about you don't know what what it's like until you don't have them.
So I was here at KU, plastic surgery department. Norma was updating my areola nipple tattooing, because I do the medical tattoos that can fade over time, but they're safer for when you do scans later. And she said, by the way, we can do eyebrows. And I'm like, you can, because this is after my cancer had metastasized, so I'm in treatment again and losing my eyebrows again. And so so anyway, I'm like, wow, that's great. So we set up an appointment, and I got my eyebrows. So
Looking good. Heather, what was it like to lose your hair? I mean, you've got gorgeous hair. I have hair envy right now. So again, breasts are important, hair is important, no shame in the game. What was that experience like for you?
I agree. That was probably worse than actually losing the breast, is losing your hair. You just don't feel, well, there's my wad of hair that I fell out of my head. So it's that's the worst part, I would definitely say, is losing your hair and trying to go out, do things with your family, do things with your kids, and you don't want your kids to know that you're sick, and you don't want your kids for you to look like you're sick, and that's just awful.
The visual of it was really tough for you. You have a show and tell, because I want to show wigs that you got actually at Missy's Boutique over at Westwood Cancer Center. So fantastic, right, Dr. Corntager, where women can go and just walk in and just be welcomed in and kind of really help them visually get through this journey, right?
Yeah, they've got so many different products there that can help people just feel more comfortable with what they.
All right, let's see these gorgeous
okay.
wigs.
So I lost my cancer 3 times, and my hair 3 times. And the first time I had long blonde hair, and I kind of wanted to look the same. So this is the wig I got the first
And it's like
time.
super high quality. It's
Yeah.
really attractive.
And they have fitters there that help you and guide you through it. So then my hair came back. It came back in gray, which was a shock to me, but my stylist said gray's in, let's leave it gray.
It is. We have to talk about embrace it. We all have to embrace that.
And so then the second
Gray is
time,
under there.
second time I lost my hair, then I picked the gray wig because I thought that's kind of where I was.
It's kind of the look you're rocking now.
And yeah, kind of, yeah. And so then I lost my hair again this year, and my daughter had just gotten engaged.
This is my favorite, I think.
And having a wedding, and I'm like, oh my word. And so I go in there and look.
You wore this to the wedding.
I wore this to the wedding.
In all its glory.
Yes.
I love it.
And I love how they make it look like with the roots, like it's
With roots, like when
it's
I let my
real.
roots grow out. It's
Yeah.
perfect, right?
So this
That's
was
what
my
it looks
latest
like.
one. So
And your wigs were covered by insurance, correct?
Yes.
Heather's, yours were not.
No, unfortunately, no.
Dr. Cortager, does that happen a lot with cancer treatment and
Yeah,
some of these things that women are trying to do?
There's a tremendous lack of support and lack of equity, sort of among people, and what treatments they can get and what's covered. So, and it's really unfortunate that finance has to become part of the struggle.
Well, and what do you say when people still have we moved the needle when it comes to, we talk about eyebrows and hair and wigs and our breasts, looking the way they're supposed to look, and people thinking that's cosmetic?
Well, we always are emphasizing that, and it's sort of crazy. Women are more than 50% of the population, yet we don't see these kinds of things often in men being referred to as cosmetic. So I just think it's something that we have to continue to advocate for, and we do that nationally. We advocate, and there's been a lot of progress made over the years, but there's still
We're not there yet.
Not there yet.
Getting there. Heather, anything else that we haven't talked about that you're learning to embrace, something that's changed about you that maybe another woman is going through or may go through in the future that you want to share?
I think just embracing your own confidence and sharing your story and encouraging other women to have their mammograms, and encouraging other women to be willing to stand up and fight for what you want. So if you want your breasts back, get them back. If you don't want your breasts back, that's okay too, because I have a very dear friend that didn't, she was fine. They're gone, she's happy. But that's what she wanted, and so just being able to embrace what you want and fighting for what you want and being your own advocate.
My best friend's mom just recently passed away of breast cancer, and it was her mom was like 72 years old and still wanting to get her breasts reconstructed, and my girlfriend was always like, Mom, that's ridiculous. No one's looking at them anymore. And I told her, I said, well, she's looking at them, and she wants them, and if that's what she wants, just go for it. So, Cammie, what about you? Anything else that we haven't talked about that maybe women out there may have on the horizon and need to know about?
With the body image, or
just changes. Anything else?
Yeah, I don't know. I guess when it's all kind of stripped away, you kind of realize that you're more than your body. Really, we're a soul that inhabits a body rather than a body that has a soul. And just I think too that. That like you mentioned, just helping others. You when you go through this and you come out the other side, you just have this care for others, and you realize honestly, you find your life when you give it away, and there's such joy in that is worth more than maybe what our body looks like.
Really well said. Be sure to ask your questions. You can use the chat on YouTube or Facebook, tweet us, or email us at the Medical News Network. Info is right there on your screen. Let's turn to Dr. Dana Hawkinson this morning. Good morning. How are you?
Hi, doing good. A little chilly. But right now, again, this week we have under 20 patients. We have 17 active patients in the hospital with COVID. Still really nothing as far as hospitalizations for influenza and RSV, and we should be able to be bringing you those numbers here coming up soon as we are now entering into November and really the main part of the respiratory viral season. So.
Okay, so we are one step closer to kind of a one and done, getting the combo vaccine for both the flu and COVID. Drug makers Pfizer has announced early results from their phase 1 and phase 2 trials. They say it generated a, quote, robust immune response, but we're still waiting to see the data in that peer-reviewed journal. So, Doc Hawk, how close are we to really seeing that combo shot? Could we see it this season?
No, we're probably about 1 or 2 years away. We know that earlier in the month of October, Moderna also announced that they found a robust immune response in those early studies when they did the combination influenza and COVID vaccine as well. So we have two of these main companies, especially for mRNA technology, have both announced that their combination vaccine for influenza and SARS-CoV-2 have developed or created those robust immune responses in patients. Now we will start to look at more benefit and efficacy of those vaccines, those phase 3 trials. These were more for safety and just looking if you develop an immune response. It does seem to. I know Moderna hopes to start their phase 3 trial later this year or early next year. And I think the expectation is that maybe by 2024 or even for sure by 2025, these combination vaccines will be available. That is a good thing. If you can get one stick instead of two, that will always be good.
Yes, that would be good news. Hawk, thanks so much for sharing. Let's get to some questions from our viewers this morning. Jean and Marcia have kind of similar questions, but wanting to know if either of the ladies have had any issues with lymphedema and if there are concerns that continued surgeries could increase the odds of having lymphedema. So I'll start with you, Dr. Korntager. Does that happen?
Actually, generally, the reconstruction can help decrease and can help improve lymphedema. When you're adding sort of these new healthy tissues with robust blood supplies, especially with the autologous reconstructions, that can actually help improve it. And then we've got one of the few programs really around the country that specializes in lymphedema treatment as well, and does what we refer to as super microsurgery because the little lymphatics are so tiny. So we've got great options in many cases.
Yeah, we just did a program highlighting our lymphedema program.
Yeah.
It's quite incredible. Heather, has lymphedema been brought up in your world?
Well, luckily here at the health system, we start screening for it at one of your first appointments. So there's certain, I don't know what the tools are exactly that are used, but you're measured and you're followed for that change in your body. I thankfully have not experienced any lymphedema at this time.
Cammie, what about you?
No, me neither. But like Heather said, right away I met actually Dr. Korntager's wife,
Miss Sabrina.
Sabrina.
Yes.
She was my lymphedema nurse till she just retired this year. But so she saw me regularly. So no, I had no issues. But the technology that they're using here at KU, they can catch it sooner.
Right. They catch it extremely early. It's something called an LDEX. And she developed a program to prevent the lymphedema from progressing.
Your wife did this.
She did. And it's really been pretty remarkable, the decrease in frequency as a result of the program that they have.
Yeah, that has been her passion up until her retirement, or her so-called retirement.
It's so-called retirement. She's still finishing off actually one of the research papers that she's working on with the breast surgery team.
Fantastic, fantastic. Heather, are you considered cancer-free?
Yes, I think no cancer detected is
no evidence of disease.
Evidence of disease is the official term that we are using.
And you'll just continue to get regular screenings and checkups with your physicians.
So interestingly, there's not a regular screening that I'll receive because I don't have breasts anymore. So my breasts are now my belly. So we don't need to mammogram those. So now we just look for any warning signs that the cancer may have gone to a different part of my body.
Just monitor you in those ways. So on that note then, Cammie, someone would like to know, you lost your hair multiple times. So explain to folks why you've lost it.
Oh, okay. So I was diagnosed with stage 3B in 2015. And then went through about a year of treatment, and then no evidence of disease. Well, fall of 2019, started having extreme shortness of breath, and lo and behold, my cancer had metastasized to my lungs and liver, innumerable nodules in my lungs. So starting in January 2020, I was on an IV chemo, Abraxane, that I lost my hair the second time. So since then, I will always be on treatment or go to comfort care when I can't take the treatment anymore. And so I'm on my 5th line of treatment now in these 3.5 years. And so the one I started in February of this year in HER2 is why I lost my hair the 3rd time. Then that stopped working, the cancer started growing again, and I'm now on Xeloda, which is an oral chemo. So.
It's just so unbelievable to see you sitting here with me again on our program, living. I mean, living so well with cancer. Dr. Korntager, what's that like to, as a physician, to see a patient living with cancer and doing it well and fighting back against it?
You know, that's what we all hope for. You know, we never know how long we're going to live, and we just want to have the best quality of life that we possibly can. And you know, the advances that are being made are really pretty remarkable. And being at a comprehensive cancer center here, it gives patients, you know, opportunities that they just don't have elsewhere. So we just want to keep moving it ahead.
Entering into trials and just having these teams working together and trying to figure this out and beat it. Question is, what options, Dr. Korntager, do patients have if they do not want to do surgery, but they still want to look maybe like they've had the surgery? Are there a type of like inserts and things like that women can buy?
Sure, there are, and Missy's Boutique is the place that we use, and they've got a variety of different, you know, bras with different prosthetics and inserts that will help, you know, look in clothing, in bathing suits, to look as natural as possible.
Because as you mentioned, Heather, not everybody, it's not for everyone. You do you, right? I want to get our takeaways today. Such a great conversation and so important. Dr. Korntager, what's the #1 takeaway from our conversation?
Well, you know, the takeaway is that you've got options. And, you know, what we want to do is, you know, talk about what the options are so that it can be, you know, your choice as a woman. One extra thing that I'd just like to mention is that I think it's really critical early in this process that women don't try to just sort of do it on their own. Women have a tendency to, I am strong, I can do it all. And, you know, I encourage people, give yourself time to heal.
Give yourself that space and grace. And Heather she was shaking her head when you said that we want to do things on our own. Heather, what's the takeaway from your story?
You just took the words out of my mouth. Definitely don't do it on your own. Talk to your surgeons. I know I cried in your office multiple times, and just let the healing hands here at the university be there to support you in all ways, not just to put you back together again.
Well said. Cammie, what's the takeaway?
Well, you know, I'm like we said, I'm still in cancer treatment. This current chemo causes insomnia, so now I have, you know, dark circles and bags under my eyes, and so it's like, you know, constantly the side effects are changing. And so you know, it's like I look in the mirror and I'm like, you know, the best accessory I can add is a smile. So.
God, don't you just love this woman? You could come back week after week. You're just such an inspiration and a friend, and I appreciate you being here with us today and sharing your fun wigs with us. It's fun. So again, thank you to all of our guests and of course to our viewers. Tomorrow on Open Mics with Dr. Stites, how are these weight loss drugs like Ozempic changing diet and exercise for people? What patients and providers need to know when using these new medications. And before we go, we're going to send it to some of our little furry friends from the Poison Control Center here at the University of Kansas Health System, reminding us how to stay safe with Halloween makeup.
What's this, Scout?
My mom says a mask might make me fall because I can't see as well. So I'm going to make my lips black because I'm going to be a vampire.
That's a permanent marker. That's not for your face.
Hunter is right. You should only use face paint or makeup on your face and nothing else. It could irritate your skin. And you should always test makeup first on a small area of skin to see if it itches or makes a red spot. That could mean that your skin is sensitive or allergic to it.
What's that smell? It doesn't smell right.
Oh, I think you're right, Hunter.
Oh, that's that makeup. I've been saving it all year long, since last Halloween.
Oh,
Oh, it could be expired or maybe contaminated. When makeup smells bad, it's best to throw it out and be safe. And remember, you should buy non-toxic face paint or makeup and don't apply it too close to your eyes because it could irritate them. Be sure to wash it off before you go to bed so it doesn't irritate your skin or get into your eyes while you sleep.
I can do that.
We just want to make sure everyone is safe.
Oh yeah.
We understand that sometimes, despite our best efforts, poisonings can happen. Call 1-800-222-1222 right away.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.